does look like it's working.
I think we're going to have to use the super chats for that.
So now we just see. We need to figure this out a little better.
Yeah, we need to know when we're actually going live in the
there we go.
Stream Studios.
Looks like we are
thank
going.
you for your patience with getting the stream started this afternoon. And thank you, super chats from Lindsay
already. My goodness.
Was Teresa Rowett one of them? And Deborah Walker and
those three.
What it says? Oh, that's
That's
Teresa.
that one.
Oh, because it's Canadian. It's not U.S. dollars. That's
$6.99. How does that transfer? What is the transfer?
I'm sure she gave an even amount, and that's somehow how it ended up in U.S. currency.
Interesting. Anyways.
Teresa, let us know if that's the case. So, if you're not a part of our channel, be sure to be subscribed and hit the bell icon for notifications so that you can participate in our live shows as they happen, like Teresa Roa and Deborah Walker and Lindsay Entwine, who actually used the super chat.
And Rusty Bernard and Suki, who are also joining us, who are channel members as well.
Yes.
So appreciate it.
So thank you, all of you. I believe today we're talking about...
I think you were talking about stem cells. I can say it.
Stem cells on the seashore.
Who sells stem cells in the sea?
That's not too far off from what we're going to be talking.
Who sells?
Some guy on the beach selling stem cells. That's not too far off.
More or less, yeah.
That's where we're going with this, unfortunately. So, Dr. Gwaine.
Yes.
You weren't here with us last week.
I wasn't. It was...
And we had so much super chat.
President's Day. Yeah, you guys kind of hurt my feelings there.
He is going to go away so sad.
It was one of those where you're like, oh, this is awesome. It's just Dr. Vaughn. Let's throw our money at this so we just keep this going. We don't want that other doctor back. No, never. Wonderful.
Oh, my goodness.
Oh, but we do have a number one fan from Laura Barzik.
Oh, my goodness. Laura, you're the one who did it last week.
Thank you. I appreciate. Hey, I feel redeemed.
Okay.
I do. Thank you, Laura, and Teresa, Laura, and Lindsay, and Deborah. You guys, feeling a little better. Appreciate it.
Dr. Gwaine actually looked okay by beating last week's super chat. So.
You must have changed the light in here because it looks like I'm sweating.
It's really hot.
I thought it was just me being nervous about coming back on here with all these people who really like you.
Really like one of us anyway. So thank you so much. And those of you who are thinking, when do they get on with the topic? We're coming up on it right here. We're almost there.
Yes. So
what do you know about stem cells, Dr. Vaughn?
Going back to basic biology? Should we start there?
Yeah.
What is a stem cell?
Maybe just a brief little description.
Yeah, so a stem. Not science, technology, engineering, medicine.
And don't forget the art, STEAM.
Music, art, mechanics.
The M is
math.
Math.
Gosh, wow, that took way too long. Good thing I was a STEM student.
Speaking of which, hey, if you haven't seen my personal channel, Mark Vaughn, on YouTube, there's a video there, it's also on Vimeo, that shows you about the Thomas and Jill Schroeder Scholarship that is being given to a Placer High School senior this year. If you're a fan of Mr. Schroeder, or Mrs. Schroeder, either one,
who you've seen,
you may want to know about that. So.
Yeah. If you go way back 4 or 5 years ago, he was the teacher who led us into his classroom to do a surgery on a desk.
On a desk.
In front of the classroom. It was awesome. You should go check that out.
Check out a assist right there in the
Go check that out for sure. That was fun. Yes. It's a long video, but it was fun.
Yeah. And then another.
I was only slightly nervous. I was shaking just a little because it was me doing surgery on him.
That was fun. Yes, thank you for remembering that.
The junior partner doing the surgery on the senior part. Anyways.
It was awesome. I loved it. I would do it again.
So STEAM. Anyways, back to stem cells, which we're actually talking about. So stem cells are also called pluripotent cells.
Pluripotent.
Yeah, let's use big words. Let's
Lots
sound
of
smart.
Potential.
Yeah. So these are cells that are in your body and are there from the beginning that have the ability to develop into anything, essentially. They have the ability to change into, say, a nerve or GI tissue or the heart or anything like that. So there are different stages of different stem cells, but yeah, they are mostly derived from amniotic fluid, I believe. Is that or not amniotic fluid?
We can talk about that.
Anyways, they come from they're okay. Yeah, they come from a lot of places actually, but
cord blood.
Cord blood. That's what I was trying to think. Not amniotic fluid. Cord blood. Yeah, and they have been touted to have healing properties and
I like your wording there.
Voodoo magic.
Pretty much.
Which with unfortunately little evidence to back it.
I would say according to popular belief, they can do anything.
That's kind of how
grow back limbs.
It is the the Wild West as far as what they say it can do. It's kind of the panacea of you have a problem, this can fix it.
And people
and
are hearing that.
And people hear that and follow that. So one of the so we have patients come to us all the time, asking us for advice on stem cell treatment and should I get this injected in my knee? I will point you to a podcast that I listened to probably about a year or two ago called Bad Batch, which goes into the big companies behind stem cells and the way that it's sold. It's very enlightening, but suffice to say, this is a treatment that has not been approved by the FDA, mostly because it just has not met the standards of
working.
Yeah. I was trying to think of a way to say it, but of having evidence to support it. Yeah.
There is one FDA indication. There is one, and that is to replace bone marrow that's been destroyed. Like if a person has aplastic anemia, where they don't make their own blood cells. Actually, this would be a good time to hit that button. Oh, it's not there.
Yeah.
There we go. Okay. So, they're saying I should talk, or him. Probably him.
Should I talk louder?
This is him. Let's check the levels. Oh, wow, they really are low. Okay, this will make up for lots of things. So, thank you though, those who are letting us know. So you can use the stem cells to replace bone marrow that's been destroyed, that's not making blood cells, and this will turn into the right kind of blood cells and the cells that make the blood cells. So we're talking like aplastic anemia where a person doesn't make them. Another situation is where the bone marrow has been destroyed, like with radiation therapy or some kind of chemotherapy, which is sometimes done on purpose, like for a bone cancer. And that's the one thing that has the FDA approval. Anything else is experimental. Now, it may have something called an NDI, New Drug Under Investigation, or is it NDI? Anyway, investigational drugs. That'd be NID, Nevada Irrigation District. So if it's an investigational drug, that's one thing. So you're probably working with a university, like around here, it would be like UCSF or Stanford or UC Davis. Insert the name of the big institutions where you live. If you're actually getting some kind of experimental stem cell treatment under a research protocol, that's one thing. But if you're going into a doctor's office and they're saying anything else other than the bone marrow, and that's a big deal, and that's usually done in a hospital, anything else that they're going to treat you with stem cells or offering it, you need to start looking around and asking a lot of questions, because it sounds like you're going to a shyster.
Wow. That's using big words, but unfortunately appropriate words.
Yeah.
So here's a great comment. This is Real Ruler.
Oh, you're reading the comments?
You just, they said stem cells can do anything, but you have to roll a 36-sided die in order to determine what effect they'll have on you.
I like that.
Great comment. Best comment. That's wonderful. I like it.
A 36-sided die. Yeah. Then you'll know what you're going to get.
That's wonderful.
Grow another eyeball.
So typically people come into us because they have been offered or told that their joint will get better with stem cell injections. That's usually...
Marijuana joint? Like a spliff?
Oh, put stem cells in your marijuana.
They're laced with it.
That's right.
You dip it in the...
Doctor, my joints are tight.
Amniotic fluid.
Rolling them too hard.
You're rolling them too tight.
That was a joke one of my my patients.
You're rolling them too tight.
Anyway.
Okay, back to serious.
Yeah, so it's joints, like somebody's got knee pain or something, arthritis typically. Like, oh, you want to try this, or some other joint problem. That's typically where I've seen it.
Oh, yeah, a lot of it's like ortho type stuff.
Yeah,
and it may do nothing, but it has
probably in best case scenario.
Yeah, actually, yeah, but people have been hurt by it.
Yeah, so I point you back to this podcast that I listened to, Bad Batch, where unfortunately some of these stem cells got through that had a bacteria in them, and some of the people who got that batch ended up in the hospital with severe infections, sepsis, and ended up with kidney damage, a bunch of things that come along with that as a result. So. It's unfortunate.
Something else that can happen. These pluripotent, meaning they have potential to become lots of different types of cells. They can actually cause the growth of tumors and turn into different types of tumors.
Yeah, they can grow into anything.
They can grow into anything, and sometimes it's something bad. And that does happen when people are treated inappropriately, dare I say illegally, with stem cells. And this came in the news just recently because of a congresswoman in Missouri who has a special designation. They call it associate physician. She hasn't done a residency. She didn't go to a U.S. medical school, but she's able to practice medicine in Missouri. And
so she's graduated from a medical school.
A medical school.
Is a doctor.
Is a medical doctor.
Why do I say that in quotes? I guess she's a doctor. She went through medical school.
And I think it was in Antilles. I think that was the one she went to. I don't remember her name. And she has been treating people with supposedly stem cells. I guess it actually was amniotic fluid.
Ooh, okay. Maybe that's where I heard that from, and that's what I thought about.
Yeah.
Yeah.
Yeah, and now she's feeling persecuted because people are coming after her to tell her that's not appropriate, and it's not. There's no science to support it at all. Yeah.
Okay.
Yeah. I think on social media she says Satan is coming after her.
Because she's doing something that's not backed by science.
Because she's, yeah.
Okay.
So don't go to her.
Consider Satan science.
Which many people do. You walked right into it. I couldn't have set it up better.
You teed that one up for me.
Oh my goodness.
Oh man. Anyways.
He believes in science.
Why have you not been baptized?
So
I told you I only believe in science. Great movie.
Yes, for those of you who appreciate Nacho Libre, that was very good. All right, so comments, questions.
So of course the off-topic.
Off-topic, of course, yes.
Comments and questions about the COVID vaccines.
We can talk about that too. That's okay.
Yeah.
That's what it was. She was treating COVID
here's something
with stem cells.
Wow. Okay. Anyways, Lindsay does have something that is on topic. So
okay,
all
Lindsay.
of those cord blood registries are an enormous scam.
No.
This is different than that.
No.
Very different than that.
We're hoping that that's useful.
Yeah.
And yes, it is for stem cells. That's actually right.
That is. But it's in your own stem cells.
Yeah. It's not that it may not have value in the future. So, but we really don't have much right now.
Clarify that cord blood registries are for your own blood. For these sorts of things, you are getting stem cells that are not your own blood.
Oh, they might be. I don't know.
Usually not. They come from a factory. Usually.
So, yes, there's people who are doing the cord registry. That's what you call it. It's cord blood. Anyway.
I think that's what it's called.
Who will actually need it for a bone marrow transplant or reimplantation. I guess they don't call it a transplant when they do it with stem cells, but there's people who actually would be able to use that. But it's a very, very small chance that you're going to get benefit from that. It's kind of like an insurance policy, I guess.
Yeah. So a question off topic.
Okay, off topic. Go ahead.
So we know that the real ruler kind of says this. J&J is 65% chance of preventing disease. Yep. Yeah, and 100% effective.
Wait. 100%, 66%. Yeah. Okay. I'm sorry.
Yeah, at preventing hospitalization, death after 28 days. Yes. The question is, do you know how effective the other two are at preventing hospitalization and death?
Oh yeah,
no one has died who has gotten the vaccine.
Right. They're also
from COVID.
I'm not going to say a number, but they're also very, very, very high. Because it's 95% effective at preventing symptomatic disease.
All disease.
Well, except people may be able to transfer it without knowing it.
Right. But that's not.
But they're not going to be sick from it.
Your own disease, yeah. So I read a stat that the other day that 100% of all of those who participated in the pilot studies for all 3 vaccines, 100%, well, no, 0% died.
Yeah.
Like everybody survived.
Very good.
Who got the vaccine, which is amazing. Like 40,000 people or whatever the number was.
A little update on Johnson & Johnson. I believe that actually it's Janssen is their vaccine line, but that vaccine is going to go before the CDC and the FDA this week.
Yes, exciting. This week. Exciting. And if it's anything like the other vaccines, it'll be pretty quick and off to the races after that. And
we're hoping.
Be within a few weeks. Probably within,
all indicators are that it will be, and that it'll be shipping out next week.
Now, that being said, our current supply of vaccines is out.
Unfortunately, because of the storms. Although they're back up and running now. I just got an email about that today, that vaccines are being distributed again now.
Yeah. I saw a patient today who was supposed to get the vaccine on Saturday, and her appointment got canceled because they ran out.
Yeah.
So, it's unfortunate.
Yeah, I had a patient this morning also who was told they didn't have it after she'd been signed up for weeks.
Yeah, I know.
Very disappointing, but things are moving again, unfortunately. And not only that, but we'll have this week of finally getting things back that were delayed because of the storm. And then if next week, if we actually have Johnson & Johnson go in, and then in the coming weeks, it's Pfizer, I believe, who was supposed to be able to increase efficiency in their factories. They were predicting that within a month of when they did it, which was 2 or 3 weeks ago,
should be pretty close.
That they'd have a 40% increase in their productivity. So we should be seeing some pretty good numbers for vaccine distribution in the next few weeks.
Yeah, in the United States, the
and we're already
administration has already bought
enough.
Yeah, enough for essentially every American.
And we already have 12% or 12.5% now of Americans vaccinated. 1 in 8 people is vaccinated already, or at least got the first shot anyway. Yep. So
Should we tell people how what people's reactions are, or at least what we've seen?
Yeah. When we see people get the vaccine,
Yeah. So mostly older folks, definitely those 75 and older, but all the way down to 65. They are positively giddy.
Yes.
It is amazing.
You heard the quote that Polly gave of...
Yes, but you should definitely say that.
Okay. I want to get the wording right. I want to say it exactly the way she said it. I'm as happy as I was on my wedding night.
Yes, that was the quote.
Well, happy or excited?
Either way.
Okay. People... So Polly, it was a bit of a job for her to set up, because you have to follow so many rules to give the vaccine. But not that we're giving it.
We ran out because
we ran
supply.
Out. We did. We don't have it.
Yeah.
If you're over 75, call me. But no, don't call. We'll call you.
Seriously, don't call us. We'll call you.
Don't call us. We'll call.
Because we don't have any. Seriously.
But she was kind of dreading the whole process, and then found that, oh my goodness, I'm like the person who lets the kids into Disneyland. Everybody loves me, and
I know she's just like getting all the.
It's pretty cool.
Yeah, all the positive energy from these people.
Let's find out. Any other appropriate comments that we should address?
Are you saying there's inappropriate comments that we should not address?
I'm not reading them, so I'm not to say. Or is it just conversation between the people in the chat?
Yeah.
Yeah, we got to figure out a way to kind of file through, find the, dig for the...
That's all the big stuff.
Okay, so, Dr. Gwaine, you have drgreenknight.com, the blog.
I do, yeah, a new blog out for that. So go check it out. This one is a more personal one, talking about the Lent season leading up to Easter. And just how this Lent is a lot different from previous ones for me. So go check that out, drgreenknight.com. I do have a few patrons over there that I'd like to thank.
I think they're matrons.
Matrons, yeah, I guess so. Boo Boo Kitty and Teresa Rowat. Thank you. And Teresa Rowat's here, so appreciate
Excellent.
it. Thanks for what you do.
And I also want to thank Lindsay, Antwine, and Boo Boo Kitty also for everything. And not only them, but also all the people doing the super chats. What are you laughing about?
I'm laughing about Lindsay's...
Okay, what's Lindsay say? She was excited about... Don't block her. She's okay. Good one. Good one. I'm not going to say it on the show. Yes, Lindsay Entwine and Boo Boo Kitty and all the people doing the super chats. I want to remember the name. Who did that super chat after all the other ones?
Go back up. That was Laura Barzik.
Laura or Laura?
Laura.
Laura Barzik.
Yeah,
2 weeks in a row for the super chats.
Number one fan.
Number
That's
one
at least
fan.
what the little jumping and little emoji guy says.
Thank you. Thank you. We have lots of fans. And we love all of our fans, and we really enjoy having them participate.
For making me feel loved. And by my position here
matching
still,
last week's super chat. Very good. Very good. And we do apologize for the hiccup in the start. We may be using the super chat toward a solution for that. So, Dr. Gwaine?
Yeah. Hey, I'm Dr. Gwaine Vaughn.
Dr. Mark Vaughn? Still telling all of you to stay in good health.
Oh, we'll see you.
That was great. Good job. No, social distance.